Have you ever wondered who might be most vulnerable when certain health conditions spread, and how we can best protect them? When it comes to preventing tuberculosis, or TB, the groups most in need of education are people with weakened immune systems, individuals living in crowded or institutional settings, those who have traveled from or resided in countries with high TB rates, and healthcare workers. The reason these groups are particularly vulnerable lies in their increased risk of exposure, or their body's reduced ability to fight off infection. For example, people living with HIV, diabetes, or those on certain immune-suppressing medications have weakened defenses, making them more likely to develop active TB if exposed. In crowded living situations such as homeless shelters or correctional facilities, the close proximity of people makes it easier for the airborne bacteria to spread. Furthermore, individuals arriving from or living in areas where TB is common often face a higher chance of exposure, while healthcare workers are regularly exposed to infected patients in their professional roles. For these key groups, prevention education needs to be targeted and practical. It should include clear information on recognizing early symptoms, the importance of prompt testing, and the critical need to complete full treatment courses if infected. Understanding how TB spreads and practicing good cough etiquette are also vital steps. This targeted approach is part of what public health experts call differentiated care, where interventions are tailored to specific needs. By focusing educational efforts on these high-risk populations, we can break chains of transmission and provide timely interventions, moving closer to controlling the spread of TB. Ultimately, directing TB prevention education to these specific communities and individuals not only safeguards their health but also creates a stronger defense against TB for the entire population. It empowers those most at risk with the knowledge and tools they need to protect themselves and others.